And welcome to the event tonight, which is all about the use of unbiased data in policymaking. My name is Pete Damiano. I'm director of the University of Iowa Policy Center. And behalf of all of my colleagues, I want to welcome you, as well as our co-sponsors for this event, the Department of Political Science, the School of Journalism and Mass Communication, Department of Sociology, the College of Law, the Iowa Informatics Initiative, and the Iowa City Foreign Relations Council. So this event tonight is something that's really important, I think, to the mission of the Public Policy Center in particular. This is our 30th anniversary year, and our primary mission at the center is the creation of new knowledge through research and sharing that information with policymakers and the public. There's been a lot of discussion, as you know, in the press these days about fake news and about alternative facts and all those things. Can be troubling for those of us who are trying to develop new knowledge and share that with policymakers and public for their use. On the other hand, there's a lot of those things that have been going on forever. You know, it's not like decision making has always been made out of facts, and we've even had the facts to be able to do that. So tonight we're going to have a discussion about, from the experience of the people that we have here, where do they see that line between where facts has been able to be used in policy, where relationships come in, and all of sort of the different levels of things that go into policy making, which is really important. And very pleased to have with us tonight former Governor Jim Doyle from the state of Wisconsin. And Governor Doyle was the 44th governor of the state. And in terms of his relevance to tonight, number one, he was a healthcare expert as a governor, has continued in that role in a number of different ways. And I do want to emphasize, we're using healthcare tonight as really as an example of, it could be in almost any different content area that we could be talking about this idea of how do you use data and information. Thus, for example, the Iowa City Foreign Relations Council being one of the co-sponsors of the event because they kind of get that relationship. For those of you familiar with them, they're a really interesting town-gown organization here in Iowa City who are interested across. And so because we have a lot of people with healthcare expertise, we're using that one as the example, and Governor Doyle here is one of those. In addition to having been governor, having done a lot in terms of healthcare issues, as governor, he's also on the board of 3 different organizations related to healthcare currently, of which data is really important. One of those is an organization called Exact Science, and he can tell you a little bit more about that. It's a development of testing and other types of clinical exam kinds of things. The second is EPIC. EPIC, as you might know, is based in Madison, and the large healthcare data systems that most of the healthcare systems are using is based on EPIC. But the other one that's really relevant to us tonight, and for those of us in the Health Policy Research Program at the Center, is his work on the board of the Kaiser Family Foundation. So they have a whole group of analysts there that are looking at different data and putting out new data and information as quickly as they can. We've got some interesting stories about that, about how to try to give policymakers real-time data as much as possible. And it's very difficult, because it takes a lot of time for a lot of that data to come out, but as much as possible to help policymakers to make those decisions. So I'm very pleased to have Governor Doyle here with us tonight to start off our meeting.
Well, thank you, Pete, for the kind introduction. We're kind of, like I say, we're kind of cousins, but we're married to people who are married to cousins. So it's like one of those Iowa families, Wisconsin families, and all kind of mixes together somewhere along the line. And I'm really pleased to be here. I will dispense with all the Wisconsin Iowa football jokes. They're just too easy. There's too much I can say. I do want to say, and I'm a little off, completely off of that. For a moment, I drove here from Madison today, which is really one of the most beautiful drives to come through southwest Wisconsin and northeast Iowa here. It's just a beautiful drive. I was reminded of 2 movies that I've been thinking about. Well, one I thought about because of the drive, one I've been thinking about, that are my 2 favorite Iowa movies. So when everybody asks you what's your favorite Iowa movie, I bet you're asking, everybody says Field Dreams. They're way off because there are 2 others. One is, I think it's called The Straight Story, about a man, I think it was Bruce Dern played it, kind of a low budget, and he was an older man who became, he fell or was injured in some way, and he then heard that he was quite a poor person, and he heard that his brother, who was also elderly in Wisconsin, was also ill, and he decided he had to see his brother. And he had no vehicle, so he drove his John Deere tractor from Iowa through all of this country I just traveled through today in the southwest Wisconsin. It was really, it has some adventures along it. It's really a beautiful one. The second one, which I actually gave a talk, and again, I'm sorry to be off the topic, but I just can't, because you and I have the greatest Iowa movie ever is Kingpin. For those of you who've seen Kingpin, Woody Harrelson, Bill Murray. And there is a truth that comes out in Kingpin. So Kingpin, any of you from Iowa haven't seen it, you better watch it. Woody Harrelson is won the Iowa Bowling Championship, and he's an up-and-coming young bowler, and he's on his way to fame and fortune as a professional bowler. Bill Murray is the champion, the world champion bowler. And Woody Harrelson goes after trying to, and they team, even though they don't like each other, they team up, and I think this happened in Iowa in the movie. They team up hustling some people at a bowling alley. And the guys in the bowling alley figured out they'd gotten hustled. So they grab Woody Harrelson. Bill Murray, the coward, runs away. They grab Woody Harrelson, they put his arm, excuse me for this, but it's actually comedic, put his arm down the ball return and cut his hand off. So Bill Murray, Woody Harrelson now has no hand, he's done bowling, he's got a big, he has a plastic hand that he walks around with, but he wears his Iowa Championship bowling ring. So he finds Randy Quaid, who is Amish, and Randy, I think also from Iowa, I think this is where they all came together, and Randy happens to have a great ability to bowl. So Woody Harrelson moves Randy Quaid through this. Woody Harrelson's life has just gone to hell. He's drunk all the time. He's just, his life is down. Bill Murray is up here, he's the champion. Woody Harrelson is down and out, but he's got this Randy Quaid, and he manages him and starts moving him along. Finally, Randy Quaid goes to the World Championship for the National Bowling Association Championship. This is a big deal. It's 20 years later. I'm actually going to make kind of a serious point about this, but it's an amazing story, I think. So, Woody Harrelson, first place, Woody Harrelson goes up to enter Randy Quaid at the bowling, and they say that'll be $100. And he says, I don't have any money. I said, well, I'm sorry, we can't do it. So he puts his plastic hand out with the ring on it, the Iowa champion bowling ring, and he says, what will you take for this? The woman looks at it and says, what would I do with a plastic hand? But then the key moment comes. And Bill Murray is just this totally obnoxious guy, and they're at the buffet dinner. And Woody Harrelson goes up to Bill Murray, and he says, I've been thinking about this for 20 years. What would I say if I ever saw you again? What would I say to you? I've been thinking about this. To which Bill Murray goes, you're still hung up on that? I got over that a long time ago. Now, the serious point, and I don't know, it seems to me that this kind of takes in what the Kavanaugh hearings were about. That one person saying, you're still hung up on that? I got over that a long time ago. I don't remember it. What's the big deal about all this? And then the bowler with no hand, whose life has been completely changed by what happened, just staring at how you even, that's what Woody Harrelson just looks at, and there's just no way he can even respond to it. And again, I only say it because I came through Iowa and thought of that movie and had been talking about Kingpin just about 2 nights ago in connection with the Kavanaugh hearing, and it is in the heart of a lot of what goes on here, which is just the difficulty to empathize with what the other person has gone through. So yeah, Bernie McCracken and Bill Murray, he was long past this. He probably worried about it for 5 minutes, whereas Woody Harrelson lived a lifetime with it. It seems to me that's what we just saw played out in front of us, and it happens in a lot of human endeavors, including
It happens, I hope you all heard the Woody Harrelson story. But it happens in a lot of areas, including healthcare, in which it is often very difficult for healthy people to empathize or think they have any responsibility or to pay for or to be part of a system in which somebody else is really struggling. And so that's Kingpin. So those are the two great Iowa movies. Field of Dreams is fine, but these other two are really great Iowa movies. Pete mentioned a couple of organizations, so let me just, the topic of this is the importance of unbiased data. So I think I can pretty well wrap that up. It's better to have unbiased data than biased data. That's kind of the end of that discussion, isn't it? But I do have a couple of responsibilities now since I've been governor that have been very critical. But I will say, as governor, I'm very proud that when I left office, Wisconsin had the second highest percentage of people covered in the United States. Only Massachusetts was ahead of us, and they had a mandate which we didn't have. We had, with Iowa and Minnesota, among the lowest health care costs in the United States. We had pretty much done away with uncompensated care, and we had built out a Badger care system that applied not only to what the federal government would give us Medicaid money for, but we had built a system that allowed working people who were not eligible to buy into the Badger care system. So we really got to nearly, I think at the end we had almost 95 to 96%. It's been changed a lot in Wisconsin since then. The system's been retracted. We refused to take part in the ACA, and all kinds of other things happened. But this didn't come to me, when I think back when I was running for governor, in 2002, this wasn't like the top issue on the table. In fact, he wasn't my immediate predecessor, but he had left to become Secretary of Health and Human Services, but Tommy Thompson had been one of the Republicans that had really built out built out the Medicaid and children's health programs, and he had done it with a Republican ideology, which was, we want people to get to work, and it was actually part of the welfare reform program, which we could argue whether that was good or bad, but on this point it was, if you go off welfare and go to work, we're not going to have you lose your health insurance. And that was a solid, mainstream Republican idea. The current Republican governor of Wisconsin, this has happened all over, has cut us back from our Badger care that went up to, I think, at about 300 in some cases 350% of poverty for eligibility, has cut it back to 100%, and has basically turned on the basic Republican theories of the 1990s of welfare reform was get people to work, but make sure there's job training money and make sure that there is health care money and that they don't fall off a cliff. As we built out our program, I cannot emphasize to you how important data was. It was really critical to figure out who the people are and what they needed. And I'll give you an example of where a fight happened with my Democratic friends. Our expansion of Badger care, the big expansion, happened under a Republican administration. Mike Leavitt was the Secretary of Health and Human Services, and he gave us one of the largest waivers in the country, and really the last waiver that they gave. And the waiver that he gave us, he was big on what were called skinnier plans, or not the full Medicaid plan. So he offered us a deal, which was he would agree that we could expand up to 300% of poverty, bring in all of these, in Wisconsin, I think about 200,000 more people, but we had to agree that we would cut back on the full Medicaid program. Well, what did that mean? In political terms, that was just a no-no. You didn't do that, because the Democrats said, I had wonderful members of Congress, and Chair of Appropriations was from Wisconsin, a dear friend of mine, Dave Obey, and he was mad as hell, which he could often be, as Jim would know, Obey could get mad, and he was mad that I was caving into the Republicans on this issue, that you weren't supposed to give an inch on this. Well, we actually had people look at what this meant. And what it meant was the so-called modified plan covered about 96% of what the full plan. This was a question between over an ideological fight, of which the Democrats were probably right. I mean, I'm a Democrat, they were probably right. But was I, as a governor, supposed to say to 200,000 people, you're not going to get 96% or 95% of the level of benefits that the people on full Medicaid got? But having those numbers was critical to this analysis, because the politics sort of didn't care about the numbers, but when you came forward and said, look, this is the actual numbers, this is what's being offered. And I'll tell you today, people who are on Badger Care Plus, because of Badger Care, I never once in my years as governor heard one of them ever complain about the level of coverage that they were getting. So it was a case where political people, Mike Leavitt, who had a point he was trying to make. He was looking for a friendly governor, in Washington politics, he was looking for a friendly Democratic governor who would buy into his plan. He found, we had known each other, we were governors together. He had found one who also already had a really good program, so we weren't, it was something we really could do, and we were able to make a deal. And I really truly believe we were able to make it. I mean, I was willing to make it, because I actually had facts in front of me that would tell me what this is. If I had listened to just what was being told to me by those that didn't ever want to make a deal with a Republican, I would have thought that those people were going to get nothing or get some sham kind of coverage. The Republicans who really hated this, the Republicans that were mad at Leavitt, I mean, when I say the Democrats were mad at me, it was nothing compared to how mad the Republicans were at Leavitt over having made this deal. But for them, it was a massive giveaway to a bunch of people who didn't really deserve anything. So there we were, caught in political rhetoric, when there were actual people who, when you looked at the facts, saw what you could get done, you could get something done. So it was critical. And that was true in all kinds of areas. Today, as Pete mentioned, I'm on the board of several organizations dealing with healthcare, but I'll just run down them quickly to show you how important data is in this world. Kaiser Family Foundation, which I will brag a little bit, I think is really sort of the premier policy and economic analysis organization, also polling, and we now have the largest health news bureau. We'll hear from Tony later, but the Kaiser Health News is the largest health news bureau in the United States. And it is devoted to the idea of good analysis of health policy, but has grown in recent years around the idea that not only should we be just reaching to the policymakers, which was kind of where this organization had been for many years, go up to Capitol Hill, inform members of Congress about what they would do, what this Medicare change or this Medicaid change might do, and so on, and really run the numbers and give them that analysis. But it became clear to really affect healthcare, you had to have the public have that information as well. And that's really where Kaiser Health News grew out of. It was not just to have the analysis, but to make sure that that analysis is distributed widely. And now through not only helping health journalists all around the country with partnerships with NPR, with the Washington Post, the New York Times, with opening up a Washington and Chicago bureau, looking at opening up a Midwest and Southern bureau. We're trying to get health information, health policy information, not just to, we're going to continue to do the members of Congress and other policymakers, but to also get it out more generally. I hope some of you have seen, for example, we've done a series and are doing it every month, of Bill of the Month, with CBS News, which is Kaiser Health News and CBS, and they find these horrendous cases. And as somebody mentioned to me at dinner, that one case always gets fixed. But hopefully it spreads some light on some of the real issues that are affecting real people. I'm also on the board of a company called Exact Sciences, which, if any of you have seen these ads for Cologuard, it is a stool-based test for colon cancer. And I won't give you the whole sales pitch. But this is an entirely data-driven company. This is based on analysis of genetic material coming through the digestive system and finding the markers that are indicative of either colon cancer or pre-colon cancer. It is a way to avoid the colonoscopy of all of that. And there's, so again, I won't give you the sales pitch, but it's entirely a company whose, and this is true of many medical companies, whose existence and success is going to completely depend on whether we collect good data, distribute good data, and can convince people out there that this data is real and that this is effective. The third board that I will mention that I'm on is probably the motherlode of all healthcare data in the world, which is Epic Systems. Epic now has 70% of the medical records of citizens of the United States are Epic medical records. If any, I don't know, does the University of Iowa Medical use Epic? Every big system does now. Now, Epic does not own this data, but it is the caretaker for the data, and if you think about it, outside of Madison, west of Madison, 5 stories underground are these blocks of servers that has everybody's medical record in it. But in that data are the answers to almost all medical questions you could ever ask. And one of the real challenges we're going to have, and you're going to hear from a very good panel that works on this, is how do you get to that data and how does it get used? How is it protected for individuals at the same time being able to be used for the general health of the population? So data is critical, and in my public life and in my private life, it has been critical in what we're involved in. But I really am here, I guess, to make a couple of other points. I teach at the La Follette School of Public Policy in Madison, the university, and I always start out by saying, you guys have spent all these years studying policy. Let me just tell you, none of it matters unless you can get it put into law in some way. So you have to have some sense of what the politics are that are going around with all the data that is created. So data without values is really just kind of to gather facts. I'll give you an example, not a health example, but it's one that always sticks out to me. We were dealing with a really difficult issue, as is true in every major city, with the Milwaukee public schools. So these, there are these, and they're wonderful organizations, God love them, but these big national consulting companies, and they think they can solve all your problems through data analysis. So we hired one of them. I won't mention it. They're in the Twin Cities, but everybody knows them. They're like the biggest in the country. And we came in to have them help us figure out how we could find savings in the Milwaukee public school budget to make sure that we could be applying it more to the things that were needed, instruction primarily, but some other needs. They study it for 3 or 4 months. And they come into the governor's office of Wisconsin with their results. They bring in the big senior partner who hadn't been involved in this at all, but to make a very impressive show. And some of you may have worked for these organizations. They're great. I'm not trying to, but it's sort of, and so we sit down around the big table in the governor's office, and they reveal their results. And I listen patiently and patiently and patiently. Well, here's the way they decided to get the savings. They decided to get the savings that if you took all the hourly workers, the food service people and the janitors and the others, and you knocked them down from whatever, $15 an hour to $11 an hour, whatever the numbers were, then they would be eligible for Badger Care, and then we could book the money that we would save on health care for these people. And I looked at them like, do you have any idea who I am? I have been working diligently to try to expand the number of people who have health care. We want the custodial staff and the food workers, many from very poor neighborhoods in Milwaukee, and these jobs are great. And why are they great? Because they got health benefits. And those health benefits are supporting not only that one person who's working in the cafeteria, but they're supporting several children and a spouse and all of that, you know. And it's like this had just missed them. They had made a very, you know, they had looked at the numbers, they had looked at where the savings were, and they just didn't have the value. It's not to say they were mean people. It's not even that I ever, in fairness to them, I never said don't ever go touch health care, but it's kind of where their mind worked. And you can see that in all kinds of ways that data comes to political office holders and other decision makers, and it just looks, it's, to the person who developed it, it just looks like wonderful. I mean, they'd found the answer. And to me, it was the craziest thing I heard, and they left, and that was the last we ever saw them. It was, but it does show you that data without values really is not going to come together. And obviously, values without data are really dangerous. And we are seeing a fair amount of that right now. The most obvious example is probably climate change, in which you just declare truths without data. And you do it in the face of all data, and you do it at huge risks to the population of this country and this world. So the real key to this is to be able to, to balance out the values and the data and the facts and the information that drive it. I know this is going to sound amazing to you. I do a lot of hot yoga. And, and one of the things my yoga teacher teaches me is I'll say, how come my friend who is 40 pounds overweight and is totally out of shape can sit like an Indian guru with his legs flat on the ground? And she'll say, because he has no muscle tone in those legs and he has no strength. And so you don't want that. So she's always preaching that what you have to have is just find, and everybody's body's a little different, but find the right balance between muscles and flexibility. And that's what you're searching for. And that balance, I think, is what we're looking for here, which is that balance between just data for the sake of data, that just is a lot of numbers and they drive you to conclusions that don't make sense, and values that are not just made up in the air but actually come out of the real world. So it's the combination of these that is so important. And healthcare, to turn to this, is such an incredibly difficult industry to figure out even what it is that you should be collecting data on. But we should be very clear where when you get outside government policy, healthcare has gone all the way to data, and it's just going more and more. I was having a conversation at dinner, but the whole question about the old doctor who's a diagnostician is nice, and we all had them, and they were great and everything, you know, and they check your heart. But the fact is, when you go to your checkup these days, the most important thing you do is give them the blood sample, and that's going to tell them 99% of what they need to know. The doctor is going to stop in. In addition, the doctor is going to have the computer, which people complain about, but he or she is going to bring up your name, some history, some of the other information, and if the data is backing up that chart that's there, it's going to tell that doctor what it is based on the testing that's been done, the physical examination, your medical history, what the concerns are. So the health industry has gone, you know, it is data driven. The business of healthcare has, you know, you go to private businesses, they aren't making up this stuff on their own anymore. They're really looking at the data to see what is the best way to reduce the number of hip surgeries that we're going to have, or maybe in some cases they're looking at it to be cynical, figure out how many more they're going to have. But what is it that we can do to go in the direction that we want to? So the one area, there are others, but the big area that is not been so data-driven is government policy. And I think it's because the value part of this equation hasn't been figured out by this country. We still have a very, very fundamental debate that goes on in almost every healthcare argument about whether this is some giveaway from the government or whether it's something that we should be trying to make sure that every American is provided. Now, I'm of the belief that healthcare now in this modern world is like public education or like the military, that it is one of the services that the government provides. But interestingly enough, you know, this is historical. When, I assume this is true with Iowa, but most of the states that came into the Union in the 1840s, Wisconsin is one, has an absolute right to a public education written into the Constitution of its state. Our original Constitution doesn't have that because it was a limit on government powers, plus nobody ever thought about it really. But by the mid-1980s, and particularly if you look at the history, because of largely the German immigration and the public schools that had grown in Germany coming into the United States, this was, again, I don't know if it's in the Iowa Constitution, is it? It's in the Wisconsin Constitution. It's quite a remarkable thing, because think of it, there aren't any other, that I can think of, constitutional requirements that the government actually has to provide something to somebody. And that's why this argument, I think, has become so fundamental on health care over the years. Now, to me, it's fairly simple, and it all came out very clearly, not in a Kingpin movie, but in a Republican presidential debate when Ron Paul was running for president. And it was one of those debates that had like 12 of them up on the stand and talking away. And Ron Paul gave this spiel about health care. The government has no role in health care. It was a true, give him credit, it was an honest-to-God, true libertarian view of this. Government has no role in this, you take care of yourself, and if you don't, tough. And the moderator finally was able to ask the follow-up, which often doesn't get asked to that argument, which is, okay, somebody doesn't have it, and now they're dying in front of you. What are you going to do? And Ron Paul goes, doesn't know. But the audience yells out, let him die, let him die. Not the audience in whole, but some of the audience. And that's really the question to me. If you're going to say let him die, fine, that's your philosophy, it's cruel, it's mean. But if you are going to say don't let him die, now you have government involvement in how do you make sure that they don't die. And then if they don't die, how do you try to make sure that they're healthy and don't die as early as they might otherwise die? And then how do you make sure that they're born okay? And we have so much of this regulation that goes on. So now we have an entirely mixed system of not-for-profit health systems and hospitals that were supposedly there for the charitable good, huge university medical systems that are doing huge research, are big parts of the economies of our states. Those of you from Iowa City and from Madison can certainly appreciate how important that is, not only to the health, but just to the economy of where we live. We have for-profit entities, we have employers based on this employer system of health that's grown up, and we have huge government Medicare and Medicaid programs and vets and other government involvement. We have FDA, we have NIH, we have all of this. Think if at the very beginning, like with utilities, we had decided, okay, the utilities are going to be controlled and regulated. Utilities applicate not as complicated a system, but a pretty complicated system that the data actually, there are data analysts at public utility commissions around the country that know how to analyze data. Everybody kind of agrees on what the data points are and come up with decisions. But healthcare is just far too diffuse for that. So we have, I'm sure in this room and around this university, people studying everything from how to cure diseases, to how to bring down health care costs, to how Medicaid would work better, to how drugs get through the FDA process, and so on. I'm just saying this is so complicated that data at times becomes confusing, but I would argue it becomes even more important because it is, at the end, what people do have to make decisions on. And good decision makers, I think, look at this. Now, I will tell you one of the big challenges we have right now, in my view, is this whole kind of anti-intellectual, anti-thought, I mean, I'll just bring climate change up as the best example, but look at the healthcare debates. There was a bill, one of the follow-up bills that came on, I think it was the second one, I forgot exactly the details of it, but to strip back Obamacare, not the big dramatic one. But they put it up for a vote 5 days from when it was announced, and the Office of Budget didn't even have time to do a fiscal analysis of what it would be. Just not even a time to do it. And they were all saying, we don't need that. Fortunately, Kaiser Family Foundation can turn that, aren't quite as cumbersome, and we turned it around and it became a big national news story because we actually could put what the cost was, and the cost was enormous on the change that was going to be made, and it was in the end defeated. So I guess my challenge is that at a time when it can get pretty discouraging, at a time when it looks like maybe people aren't really looking at data very much, I would suggest to all of you that are in this business, maybe it's time you got to dig down a little deeper. I really believe that the universities of this country, that the not-for-profits, the think tanks have to really continue to work hard at developing the data and policy. Because in my view, what happens in politics is moments come, sort of dramatic moments come that have been building for years. The civil rights legislation of the mid-1960s, I mean, it had been building since the end of the Second World War when black veterans were coming home and getting treated poorly. And there became this one window in time, maybe brought on by the Kennedy assassination or whatever, but just the factors, there was this window in time. And a lot got passed that opened up citizenship for citizens or people of the citizens of this country. The same was true, in my view, with the ACA. There was a time when it came about. It was an unusual time. The Democrats had the majority for this one little period of time. Obama made an incredibly difficult decision that, frankly, I'm not sure I even still agree with him on whether he should go for the whole thing and or he should have cut off some big pieces of it. But he decided to go for the whole thing. And think if people had not been doing policy analysis and creating the data and everything for years and years before that happened. In fact, Obama himself, I was one of his, I think I was the second governor supporting him, and I was a surrogate, and I would actually go around the country and debate Hillary surrogates, because Hillary was for mandates, and Obama was against mandates in the primary. You don't know all this in Iowa. You live these little things. And I would go and I would argue in states around the country about how you don't need, Wisconsin's proved to you, you don't need a mandate to get in there. You don't need a mandate in order to expand health care, and that was Obama's position, and it was a politically good decision. Obama gets into it, and the facts demonstrate, if you're actually going to put this together and you don't have the mandate, this does not work. And so the facts mattered, and this moment happened in which that got passed. If it hadn't happened then, it wasn't going to happen. The recession came, and it wasn't going to happen. So there will continue to be times in which these really major social events in our lives will come to moments where the policymakers have to deal with it. The historical reasons and others build up to that moment. And unless they actually have some place to turn to see, okay, we got to deal this, what do we do? Then we end up with really bad policy, and we could all give some examples of that. We're very proud in Wisconsin that it was professors at the University of Wisconsin that had developed Social Security. It's one of the things we go and brag about. Then they had developed what the idea of social insurance was, and that when Roosevelt looked around, he called these professors to Washington. Maybe we believe it. You probably believe it happened in Iowa, but we believe it. And it's an example of a huge social moment came in this country. And at that point, people who have been doing a lot of work for a long period of time, who probably thought, I may never see the results of what I've been working on, suddenly see it there. So those are some of my random thoughts. I apologize for starting out with Kingpin, but I couldn't help it, and I really appreciate the chance to talk to you tonight. Thank you.
Thank you, Jim. So we have cards along the aisles if you want to ask any questions. I think we'll do, why don't we have our panelists come up right now, and we'll have Governor Doyle sit. And while you're thinking about what questions that you might want to ask, we're going to introduce our panel. And so I do want to say that this event tonight is part of our Fork and Brock series that the Public Policy Center holds, which is a part of our engagement series of trying to share that information and knowledge with policymakers and the public. It's named after the founding director of the Public Policy Center, Dave Forkenbrock, who was a big believer in the importance of a university playing a role in creating that knowledge and getting that knowledge out to policymakers and the public. And so that's a real important part of, again, of our 30th anniversary year that it is for the Public Policy Center. So we're going to have some speakers tonight who are going to add from a slightly different perspective about looking at data and policy making. And down on the far end, we have Tony Leys. And Tony is a health reporter for the Des Moines Register and obviously uses data and information in his reporting all the time. Tony's been doing this since 1988. He was the paper's state editor and politics editor before becoming its lead healthcare reporter in 2000. So he's been involved in a lot of the state level healthcare discussions and debates and covering those that Governor Doyle was just talking about in Wisconsin. We've had parallels for many of those going on here in the state. Most recently, as we were talking about a little bit earlier, it's all been about Medicaid recently. And so Tony's got some interesting perspectives about covering that. He's also a board member of the Association of Healthcare Journalists and a graduate of UW-Madison. Next to him is Jen Harbison, and Jen is currently with the UI Healthcare right now and has been since 2015, serves as the Director of Health Policy, where her work focuses on state and federal legislation and regulatory matters. Previous to that, she was also a legislative affairs person with the Department of Human Services, and before that was a lobbyist. So she's got 20 years of healthcare experience in seeing how policymakers and state agencies and others use data or don't in trying to make policy. And so another slightly different but important perspective. And next to her is Colleen Campbell. And Colleen, Dr. Campbell is the UIC Director of Genetic Counseling Operations and the Assistant Director of the Iowa Institute of Human Genetics and a clinical assistant professor in internal medicine. And in terms of the relevance to this, she's led a successful legislative effort to license genetic counselors in Iowa. And Colleen and I have talked several times about the work that she's done at the state legislature and has worked very effectively across the aisle in the last few years in a way that not many people have. And so she can sort of bring an interesting perspective on where's the data, where's the line for that versus the relationship versus everything else, and how does that all play out. So we're going to give them each about 5 to 7 minutes to be able to make some opening statements, and then we'll take questions with your cards after that. Tony, why don't you go ahead and get started, please?
Sure. So I wanted to talk about something depressing, which is that shoddy data work is way easier to market, especially these days, to the public and to the media than good data work is. And it's largely because Facebook and other social media is where people are going to get their information, and it's frankly where the media is going to sell the stories that we're producing. And Facebook is where people go to learn that coffee makes you smarter, red wine makes you live forever, that 2-minute exercise routines are as good as marathons, and that new miracle drugs cure cancer in mice. Facebook doesn't love explanations of why correlation doesn't prove causation, and it doesn't have room for a lot of caveats about data. An example I saw a few weeks ago, one of my very liberal friends had reposted something or shared something on Facebook. Somebody had taken cancer incidence data and broken it up by congressional district and had found out that cancer incidence was highest in Iowa in the 4th congressional district, which is home to Steve King. And they were saying that this is yet more evidence that Steve King is a terrible congressman. And I sent my friend, it's a really good friend of mine, I sent him a private note because I didn't want to get into this in public, but I said, you know, I get why you guys don't like Steve King with their racist tweets and everything. but I really don't think that Steve King causes cancer. And my friend sent me back a message that said simply, prove it. And I think he was kidding, but I let it drop. This leads to pressure on researchers and on university PR departments to sex up their studies and their data to get the public interested and to get reporters interested, frankly. And there was a really cringeworthy case that came out a few weeks ago. A Cornell University nutrition professor, I don't know if you guys saw this story, had to resign after several of his papers were withdrawn, including by JAMA. I think he had 6 papers in JAMA that got retracted. His team had been using data dredging to reverse engineer findings from other people's studies about nutrition, and he was telling them to try to find viral findings. And the headlines included watching action-related TV shows increases food intake, people are more likely to buy highly caloric food if shopping on an empty stomach, and plate and bowl sizes affect food consumption. And those are all great Facebook headlines. And the New York Times story about this scandal said that the New York Times alone had cited this professor or quoted him 60 times from 93 to 16. I quick went back through my clips. I never quoted the guy, but, you know, there but for the grace of God. In reporters, we've all had our staffs cut. We're all stretched thinner. We don't have a lot of time to closely read studies and think about confounding factors. And we're facing around-the-clock deadlines, and it's easier to just take a press release from some university that has a really cool-sounding conclusion and just post it. And one quick example, 2017, this was the CDC put out a study on opioids by county, and they said that for every county in America, they could say how many opioids people were taking, and which is pretty cool, right? But when you looked at the study, they took the number of painkillers dispensed by pharmacies and divided by the number of people living in the counties where the pharmacies were located. Well, anybody who's been in rural America knows that people often go to other counties to shop, especially if there's a Walmart or a Hy-Vee where you can get your $4 generics. And I didn't see that as a small detail. I saw it as a fatal flaw. You know, you could reverse engineer that study to show that the presence of a Walmart in a county makes everybody an opiate addict. But they got a lot of play. The Kansas City Star headline was, quote, "These are the most opioid-soaked counties in Kansas and Missouri." And I mean, it's easy to do, and that headline is a great Facebook headline. There certainly is a lot of good data out there. ProPublica does good data, including very useful to people. Dartmouth Atlas, I did a story a few years ago. They did a great study that showed disparities in cancer treatment, that showed that if you're a woman in Sioux City who had breast cancer, you were nearly 6 times as likely to get a mastectomy as a woman in Dubuque who was diagnosed with breast cancer because of medical, the way they were practicing medicine. And then what we ought to be doing is spending more time explaining relative risk to the public. Both the government should be doing it and the media should be doing it. We should ease up on freaking Americans out on Ebola, which they're not going to get, and spend more time trying to convince them that boring old flu is actually a threat, which it is, because it could kill them or somebody in their families. But other than that, I have no solutions, just problems. So.
Thank you, John.
Well, that's discouraging.
I'm sorry, that's what I do.
So thanks for having me, Pete. Again, I'm Jen Harbison, and my current role, I work as the Director of Health Policy for University of Iowa Healthcare. And in that role, I work on both state and federal policy issues and preparing and collecting data from our staff at University of Iowa Hospitals and Clinics, University of Iowa Physicians Group, and our College of Medicine. So we are those entities who are hopefully producing some good research and data that's being published. When I first started out, as a student at Iowa State, I worked for the Carrie Chapman Catt Center for Women in Politics, and our director at that time put me on a research project because we had just come off the Year of the Woman in the elections, and so I was, my first research project had to do with how many times women's hair and clothing was commented on in articles for press coverage during those elections. And so I was looking at national races and Iowa races, and I remember having to drive out to Webster City, Iowa from Ames and get the microfiche and go through these articles about a woman who was running for the Iowa legislature. And so, you know, this was pre-access to everything, really. It was pre-internet. It was, you know, all of that. And that really has had a huge impact, as Tony said, on the way we get our data, we look at it, how we, you know, receive our news. But from there, I was really lucky. I got to go work for Joy Corning, who was the lieutenant governor of the state of Iowa. And she was a very passionate advocate for children and families. And so one of the projects she had me work on was related to the state children's health insurance program, which Governor Doyle just spoke about as well. So as the state of Iowa was considering what to do with the federal CHIP funding, I was working with Casey Foundation and other entities gathering information. I was also working with, at the time it was Senator Mary Kramer, who was heading up the Caring Foundation for Wellmark, and they were providing some health insurance for kids in Iowa prior to the state children's health insurance program. So we were utilizing their data to figure out, you know, what kind of model was Iowa going to put into place. And, you know, that was a great first experience for me, working with Republican senators and Democrat senators and legislators from the House. And so I really had a great entrance into politics where I really found value in data and found legislators and policymakers and entities in working together and kind of bringing forth those resources together, and, you know, not always agreeing, but putting forth, I think, good policy. And one of those things was the Hawkeye Children's Health Insurance Program, which had many people who came together to help come up with the model. And it wasn't everybody's cup of tea, because it did choose a model that was part Medicaid expansion and part kind of a private insurance model. But it proved very successful, I think, in the long run. I left that job and became a lobbyist, and my first lobbyist position was with the Iowa Medical Society. And so I was thinking I could just, you know, kind of recreate the things I had been doing and working for Joy Corning. And I remember quickly going to the State House and having my stack of books I had printed and made everybody folders and gone into the meeting. And the lobbyist I was opposing was Don Avenson, who had been the Speaker of the Iowa House. And yeah, and I was thinking, okay, I've got my notebooks. He has nothing. I'm here representing physicians, and I had information from the AMA, and I, you know, was just prepared and just went through this very probably boring presentation for the legislators. And then Don basically just said, look, we need to change this law for physician assistants, and didn't give out anything, didn't have any statistics, and all three of the legislators said, okay, let's vote this out of committee. And so that was a real eye-awakening moment for me. Not to disrespect Don's work, I think, you know, you learn a lot about lobbying styles, and definitely everyone brings their own style. And if you happen to have been a former Speaker of the Iowa House, you get some built-in credibility there. So I do think that I've been fortunate that I've had a lot of good experience kind of working with different healthcare organizations. I worked for the Medical Society, the American Cancer Society, the American Academy of Family Physicians, and then the Department of Human Services. before coming to the university. And I did, as my lobbying style was to stick with the facts, I think I became wiser in how many facts I presented and really kind of narrowing, for the biggest selling points to bring forth. I think the other thing that I found out quickly was to know the opposition's data. So that you could respond to that when you're in the meetings educating legislators and being able to respond back to that. Because we're all going to present from our point of view, and I think that it is worth the time to understand, the other side and the information that they're bringing forth. And and in that manner, it's not so much of, well, this is my data and, this is yours, and we can't agree with each other if we both don't see eye to eye. I think that's where we've had some successful negotiations. One campaign that I was involved with that was very successful in using data was the increase in Iowa's tobacco tax. And we were really fortunate to have national groups that were really providing a lot of the data on the impact of increasing your tax. And in fact, they had put together the analysis of, if you raised it by a quarter, if you raised it by 75 cents and $1, and what the impact would be to your Medicaid program and the costs incurred by that program from smoking. And it also talked about the revenue that would be generated. And so while those of us in healthcare were going into the room and really highlighting all of the positive healthcare facts, what really caught the attention at the time was how much money it would generate. And so, I think ultimately it passed because it raised revenue, and they were very focused on the money that it would bring in, but it did have positive health effects. And in kind of preparing for this, I went back and looked at Iowa's smoking and youth trends. And, after that tobacco tax passed, we did see great declines in youth smoking. I know Senator Bolcom's here and he can speak to this, but over the years, the funding that has been provided for the youth prevention programs in the Department of Health have gone up and down. And now we've kind of seen that youth tobacco smoking has had an increase. I was looking at the 2016 data. So, as I'm sure there are groups out there preparing to go back to have that tobacco tax increase, because this is, 10 years later. It was 2007 when that passed. And there's all sorts of new data to bring forth. And I would expect, just as in 2007, that the financial impact will still be a large point of the discussion. So really, I've had a good experience using data. I feel like Tony a bit right now, somewhat jaded with kind of the current politics that we're seeing. And, I still believe in going forth in the manner where we're going to present the best facts that we have. And, if folks want to come back and challenge those, I think we have the information to back it up. And I don't think we're just going to start going to the point of where we would say, well, it's this way because, and I feel like that's what we're kind of hearing from our national, or the president right now, isn't very factual.
Thank you, Jen. Colleen?
Okay. All right, so I was the non-political person on the panel, and I think that really influenced a lot of how I approached our licensure effort. And so we passed a bill in March to license genetic counselors in the state of Iowa. And I think Jen watched me struggle, as did Senator Bolcom, trying to come to terms with how to approach this as a non-political person. I'm trained as a scientist and as a genetic counselor, and I think that really influenced my approach, and I'm very data-driven. That's my inner scientist, and nothing's better to me than getting a new file of data, and I can dive into it. It's like Christmas morning every time. And I'm so happy, and every meeting gets kind of pushed to the side just so I can play with the data. But I'm also a genetic counselor, and as a genetic counselor, we're trained and we see every day in our practice that you can present data to people and they're going to interpret it differently. They'll interpret risk differently. And so you have to be very careful in how you present it and presenting it data in an unbiased manner. And I think about, just this one couple that comes to mind where I was counseling them. Their son had a really serious epilepsy condition. And they were debating between the two of them if they wanted to have more kids. And I said, well, there's a 25% chance that you will have another child with this same condition. And the husband was ecstatic. He's like, really, that's it? And he's like, great, let's go. And the wife was like, oh my gosh, that's so great. And here they were sitting in front of me. They heard the exact same statistic at the exact same time in the same context, but they had very different views on that statistic. And one thought it was a really high risk and one thought it was really low. Ultimately, the husband won that battle because they ended up back in my office a few weeks later pregnant. But, and they had a healthy child, which was very good, the 75%. But I think it's really important, and I've learned through those experiences how you do have to present data in an honest manner, in a clear manner, so that people can use their life experiences to interpret that data and make decisions, and make those informed decisions. And so that really, I think, was a driving force in my approach to policy. I was in genetic counseling. We don't attach emotion to it, and I think that was very much a part of when I would be at the Capitol talking with legislators. There was no emotion with the data. It was just data. And we could have probably brought in patients and had stories to make it a more emotional case, and that was something we discussed, but we never needed to go there because we just let the data speak for itself. And I think that if the data is strong, and I was always willing to pull out the reference. Jen saw me carrying around this huge bag filled with references in those notebooks that she talked about, ready at any moment to pull out the reference to back up any statistic or data point that I had given. But it's also the story in which you tell with it. And I think how you present it, obviously, people can hear the same data and present it different ways. And we've all seen that happen in the press and in government. But it's not enough to just use data alone. And I think one of the other things is that one of my core values has always been to value relationships with people. And this is just something very much instilled into me growing up. And that was something that helped me feel more comfortable approaching something that was very uncomfortable, which was the political world. And so when I was working with the legislators, it was very important to develop genuine relationships. And this had to be a give and a take. It couldn't just be, I want your vote, and that was it. And I felt very strongly that this must be a genuine relationship. And so that meant during the interim, I was still in contact with legislators, answering questions. If they needed somebody to help interpret, science for something else they were working on, and they asked me to drive to Des Moines or Ames, I did that because I felt very strongly that it needed to be this give and take and to build that relationship. And I think the data helped open the door and help gain trust, but it was also, the onus was on me to cultivate and maintain that relationship just as I would with any other relationship. And I think along those same lines, it's really critical that you respect the person, even if you don't respect their politics. And several of us have talked about that already. And it can be hard. And you have to have these blinders on and sometimes not pay attention to their voting record when you're wanting them to vote on your bill. But it is doable. And I think when you do develop that relationship, it does open up the opportunities to have some of those more frank conversations later on about other topics. We've had a lot of legislators ask us about starting a genetic counseling master's program at the university. And the first time I met them, I couldn't obviously talk about the university budget cuts. I just had to talk about my bill. But now that we have these established relationships, I can talk about how those budget cuts make it harder for me to start a new graduate program and then they can see how that impacts their constituents based on this other bill. So I think with time and building those relationships, you can have more of an impact than I ever assumed I would have. I thought I was going to go in, do the one bill, and get out, and now I've realized that there's more to it than that. So that's been really important. And I think, I liked the idea about, or the comment about sexing up studies and data. We see that a lot, and scientists get in trouble with that, and you have to be really careful with the press. And I actually was talking to a reporter yesterday, and I made a flippant comment, and then she's like, oh, let me get a pen. I'm like, no, don't write that down. Please, do not quote me on that. And so you have to be careful, and I think we really do need to think about data. And how data can drive policy, and there's that balance of data and relationships. But I also think that we need to be thinking about how data needs policy. And so in healthcare, I would actually argue we've been really slow to the data game compared to business world and consumer-driven markets. Amazon, Google, Apple, they've all far outpaced the healthcare industry with their ability to generate and interpret and use the data. And I think in healthcare, we're trying to quickly catch up because we've developed this ability to generate a lot of data, but like Governor Doyle said, we have it sitting, in these warehouses, and we have to be able to interpret it and then get it in a timely, meaningful manner to the healthcare providers making those decisions. And I think there's going to be a balance of how do we protect patients' privacy and ownership of data versus, the commercialization of data too. And so I think that's where policy will have a key role in helping drive this balance in the future. So thank you again, Pete, for asking me to join.
Thank you very much. So again, I want to remind you, we've got cards in the aisle here. If you would please fill out any questions you might have, and going around and collecting those. I'd like to start, you all mentioned the importance of data, but also how you present that. So let's start with Governor Doyle. What was an effective method that people would bring data to you? In what form that you saw that it was more easily for you to use and similar for everyone else in terms of what your position was?
That's really a good question, because frankly, you better not come in and tell me, if you're a governor, somebody to come in that gave me a 10-minute data-driven talk, my mind was gone in 30 seconds. It's really important, I think we've heard it here, to make sure you're talking to the policy people around the governor instead of the governor him or herself, because in an average day, if I was sitting in the Madison office, probably I would traveled already to Green Bay and Wausau and Milwaukee, and was back in Madison and now had 4 meetings. I would watch very earnest people come in and just bore me to death and have lost me, and then and I was polite to them, because if you want to win in politics, you don't mean to people. And then they'd leave, and then I'd usually turn to the person who actually knows something about this and say, well, Mary, what's really going on here? So I think part of it is making sure who your audience is. And when you're at the level of a governor, you better be pretty short, and you better have a pretty direct message. And you better have backed it up with the staff and with the others. You get to, really get to know who it is. I will say with Colleen's, when she says she's an amateur and then described like a master lobbyist at work, building personal relationships and all those kinds of things, I mean, that is important. And I learned lobbyists have a bad name, and to Jen's comments, I learned very quickly who the lobbyists were that I could listen to and believe and understand, and they knew they weren't going to play games, and I knew right away. I mean, I'd say, I wouldn't want to put a number on it necessarily. Let's say half of them that walked in, I wasn't really going to listen to anything they say. They're getting paid a lot of money to come in and make the pitch, that's fine. But for others who I knew were getting paid a lot of money, but they had built a strong reputation of, and we went through the whole cigarette tax, and the people who really led the American Cancer Society effort on that got us past a cigarette tax, a smoking ban, and another third part of it. And they did it just by being really fervent about what they believed in. So I think there's a room for professional lobbyists. They know how to come in, you know who you can trust. But the key is, if you're at the level of a governor who's saying you have 15 minutes and you know that he or she's had 30 other meetings that day, you're probably not going to break through with a big data-driven kind of argument. But you do want to have a couple of what the really key points are, like on smoking. Do you know if you put $2 on the gas tax, that teen smoking will drop by 40% now or something, whatever the number is? That's a fact that would move me and that I would think about, and I wouldn't need to hear a whole lot more than that.
Colleen, what have you found was a successful way of presenting data and information?
Yeah, I think I would echo the comments about the lobbyists. They were key in helping give me the background so that I could craft or present the data in a meaningful way for the person that I was speaking to, by giving me background on that person, their family, everything like that. I think, how you present the data is really interesting as well. So our bill was initially set out to be a patient protection bill. And as a lot of licensure bills are, it's a safety issue. But then there came the announcement that the governor's office was going to issue a moratorium and no new licenses, which was problematic when you're running a licensure bill. And so we quickly had to think about a different way to rebrand the bill or how to represent the data. And I was telling Pete earlier that sometimes, I've been questioned like, oh, does that feel slimy? And it's like, no, that's, as an academic, actually, we get grants turned down all the time and we have to resubmit them, or you get papers rejected and you have to resubmit them. And so so it actually came pretty naturally because that's what I'm trained to do, I guess. And it doesn't feel slimy, you just look at the facts. And so one of the facts that we had was that it was a predominantly female-dominated profession. It was a STEM workforce issue. We knew that the lieutenant governor was really big on women in STEM fields, and so instead of a patient protection bill, it became a STEM workforce bill, and that really, and it wasn't not true, it was our bill, but it was just which facts we were prioritizing. And so we recrafted the story knowing that our audience was going to be very much aligned with that message. So you have to know your audience and what data matters to them, and that volume of data that you have in your back pocket. And as an academic, I love having and thrive off of, really isn't necessary when you just need to align. And like the governor said, they don't have a lot of time and you have to be very brief with it. So what are the things that they care about the most?
Just quickly, I would say one thing that's been successful for me in my work is comparing data of states surrounding us. And so not picking, the whole country to say, like if I was working on Medicaid reimbursement provider rates, I would just pull samples of what our neighboring states and legislators seem to resonate with what was happening around us in the Midwest versus what, doctors in Florida or New York were being paid.
And I would just echo what the governor said from my perspective. People who BS with data or else with other information, you might get away with it for a while, but you don't get away with it for very long. I mean, there's a difference between spin and bull. And once I catch you doing that, you're dead to me. And I hold grudges.
The cynic.
So this is somewhat of a comment, but I think it also raises discussion points, that the suggestion here that data is the answer, but data can be collected in different ways, it can be presented in different ways, marketed differently, all is true, and I think our folks have been talking about some of that, and can be sometimes used to misrepresent data. So where is sort of the role? I mean, I don't think anybody here is suggesting that data is perfect. There is no such thing as perfect data. And how you present it, I think you've been all sort of talking about that angle. Maybe just sort of twist this a little bit in terms of what are the other things along with the data and the personal relationships that you think are important when you're involved in trying to decide a policy? Start with you, Governor Doyle.
Well, I think what I mentioned in my talk, getting to the core of the value of what you're talking about. I mean, are you there to try to make sure that more people are going to get health care? I mean, it's got a big picture. Are you there to try to convince the governor that this will have more people getting health care or less people getting health care? Is it going to cost more money or less money? Is it, so it's not, the data, again, if you're a governor, the data is, you're going to really ask your own staff about the data, but what you really want to hear is, what's the point? Why are you telling me this? I mean, why are you telling me I should raise the cigarette tax $2? Is it because, and either of these are good reasons, because the state needs more money, or because you're going to cut teen smoking? For me, if somebody came in and said raise more money, I wouldn't be that impressed. To me, you come in and say it's going to cut teen smoking, I'd be impressed. Maybe another governor would feel it differently. So you got to kind of know, but the key isn't just the data. It's obviously you're there trying to make a point, and you better be pretty clear about what the point is that you're trying to make with the data.
Right.
Yeah, I would agree. I agree with the comment, like, the data isn't the end-all be-all answer. And I was just at a summit last week, and there were venture capitalists there talking with us, and data isn't where the value is. The value is in the interpretation of the data. And so I think how people interpret it, like the timing of that matters, because at various points in your life or whatever else is going on is going to influence how you interpret the data being presented to you, as well as the team around you. I agree completely that the team, you need to be able to rely on your team to help you with that.
I would, echo the comments that have been made. I think that, one thing's a little bit differently than the data, also bringing in the people impacted by the issue. I think about the moms who came in and worked on the cannabidiol bill, and what a powerful group they were. And they were telling real-life stories about the impact of health conditions impacting their children. And, yes, there is data to back up what they were talking about, but that was really less significant than what their plea was, to give their children a chance at improved health. And I think that was really moving for a lot of legislators.
Yeah, the legislators, that was an amazing thing, because those bills had been around the State House for years, and Senator Bolcom knows that. But then those moms with those kids, that was amazing. I would say in presenting data, if there are confounding factors, and there usually are, acknowledge them, explain them, say, you don't have to go on and on, but if there's, make sure you're saying, yes, I know this, and here's what we think about that. Don't ignore it. Because if anybody else raises it, they're going to disregard your whole point then.
Yeah. Being honest about the weaknesses of the data and being upfront about it. And owning that.
And here's our interpretation of why,
Yeah.
but acknowledging it. It's really important.
I think along these same lines, one of the things is you cannot underestimate at times the strength of the opponent, and at times I'd even say the lack, the opposition has nothing to do with data. I'll give you a good example in healthcare. I had fought for 6 years to get health insurance in Wisconsin to cover autism. And, it was just heartbreaking because families, we had a Medicaid waiver program, and if you could get on after 6 or 8 months, and it was one of the best in the country because it had no income limit, even richer people could get on it, but you had to sit there and watch your kid deteriorate, even though you had health insurance, because autism was not covered. So, simple issue for me, and because I would hear from families. And you could bring any amount of data. I'm just going to give the kind of cynical. I could bring any amount of data. We would have rallies in the state capitol with like 10,000. Well, that's too high. We would have 2,000 in the capitol. Families and their kids sitting there screaming at the legislators, but the insurance companies could get to the legislative leadership and they would never bring it up for a vote. They didn't want to vote on this. You never want to vote not to give coverage. So for 6 years, we never got a vote on this. And I just want to say, I know often the people who deal in real policy analysis thinks that truth wins in the end. And, it doesn't in many cases. It is like really bad commercial, and it turned out, the insurance companies would tell them without data, oh, everybody's premiums are going to go through the roof if you do this because we don't know what autism is, we don't have a diagnosis, blah, blah, blah. It didn't have, when it finally passed, I got my final 2 years of 8 years, I had a Democratic legislature. We got it passed, and it had no effect on health care policy, and families' lives were saved. I mean, middle-class family had to sell their home, they'd have to be paying out $10,000 a month for the treatment for their child, and they had done everything right. They had health insurance. So I only bring that up as an example to say there was no amount of data that you could present. There was no amount of explanation of what the horrors were, I shouldn't say horrors, the challenges were of having a child with autism and the pressures on, there was nothing we could do. There many of these political battles, there simply are no rational, data-based arguments to be made. It is pure, hardcore politics, and when you finally kind of got a legislature that I could get this passed, get it on the floor. Once it was on the floor, miraculously, not a single vote against it when it came on the floor, but we couldn't get it on the floor for 6 years.
Right.
Timing.
Yeah. In planning for this, I was looking for a historical perspective because it does feel like with the verbiage that's being used that somehow this time is different. And in talking to some historians here at the university, their perspective, yeah, it might feel that way, but it really hasn't. You know, it's one of those more that things change, more things stay the same. And you used the example of during the Vietnam War, when you had Robert McNamara and he pulled together his brain trust and was supposed to be the best and brightest, and they were going to have all data-driven decisions about how they were going to operate within the Vietnam War. And I looked to Congressman Leach there, who would be able to speak to this much better than I with expertise, but obviously that didn't turn out necessarily so good as they were relying on just data. So I don't think any of us are saying that data is the answer in and of itself, but it certainly is a good starting point for these things. Here's a question for Dr. Campbell. Thank you for touching on community data to patients and families of patients. How can scientists, physicians, et cetera, better leverage relationships for effective involvement in policy development, especially with regard to properly presenting data? So it touches on what we've been talking about, but you've done an excellent job on indications on the relationship side.
Yeah, I know this isn't something that a lot of people will like to hear or believe necessarily, but, and I mean, my bias is going to be just, I'll be honest, like I had very strong bipartisan support. So I have friends and colleagues on both sides of the aisle, and I think that they're all trying to do the right thing. And it was amazing to me the number of conversations I'd have with people on both sides who they actually felt the same way. When you took them out of the Capitol, they felt the same way, and it was just the politics, you know, that drives things. And so I think they do want to hear, and they are trying to learn, and they're trying to do the right thing. And so volunteering and having those conversations, I think, is really important, and it's intimidating. I get that. I was very intimidated the first couple years going to the Capitol, and it's not easy, but your lobbyists can really help prepare you and make you feel more comfortable. But it's really important to just take that first step. And it's kind of a blind leap of faith. But like the worst thing that happens is that they just say, thank you very much, and they get tired and you leave, right? Like there's no harm in trying. And I think if you don't try, you're never going to be able to get anywhere. So I don't know. I think that's getting at what they were asking.
Right. Jen, what was your experience in trying to build those relationships as a lobbyist?
So when I was working for the Medical Society, we also had a PAC. And so, you know, I would say that if you have a PAC, that is an important part of politics today. We have, I think, fairly good campaign ethics laws in Iowa, and you know, we weren't giving out massive amounts of dollars, but you know, being able to go have coffee, and when I worked for the Medical Society, have a member go deliver a check was a meaningful way to have a discussion about the policy issue at the time. And I certainly didn't feel like it got us, it certainly didn't help us win every time. But, you know, so that was a helpful way to create those relationships. I think now it's really, obviously working for the university and not being a registered lobbyist, a lot of what I'm doing now is relying on the university's lobbyists through the Board of Regents. And I'm lucky in working with Keith Saunders, who's been at the Capitol also for 20 years. You get to know people, and new people that are elected will often come and seek out lobbyists that have been there for a long time. And so I think we are lucky. We have a lot of really great legislators who really want to do right by their constituents, and who you know, freely admit they're not experts in most of these subjects. And so they really do need information provided by the lobby. And so I don't know if that answers the question.
I would add, Jen's comment reminded me too. So we were a small group that was trying to do this when we got started, and I mean, in comparison to like the number of doctors in the state, we're still a small group. And so having those relationships, like I could talk to a legislator, but I'm not necessarily voting for that person. I mean, there's two people that I can vote for, right? One representative and one senator. And so I can have those conversations, but it's also important to identify people in their districts because they're so inundated, especially when things are so contentious as they've been in Iowa the last few years with people yelling at them and calling and all of these things that there's only so many people they can talk to in a day. And so reaching out, and we had to get creative sometimes on this, and finding like the parents of genetic counselors who had moved out of the state for school and never came back and were like living in some small town that could reach out to their legislature and like tell that story and why it was important in their mind to license genetic counselors. And so I learned a lot of Iowa geography in trying to identify those people, but I think it was really important that when you're thinking about those conversations is, again, who's your audience and what do they have at stake? And, you know, they need to work with their constituents. And so I think finding constituents in their area is really important.
And Tony, you're not like trying to be an advocate necessarily, but you do want people to read your reporting and believe it. Is there any role for you in terms of getting to know some of these people so that they'll trust the data that you're presenting, even if it's not data that you necessarily have developed as a scientist, but you're trying to get those data and information out there?
Probably for me, the constituency is more the patient groups than legislators as far as building faith. I mean, I think I want the legislators to feel like I'm going to give them a fair shot and I'm not going to misquote them and that sort of thing. When I'm talking to just average folks, everyday folks, we don't read our stories back to people, but I always tell them I will let you know what the story's going to say, and I always do, because I don't know if that answers your question, but I think it builds faith, and they relax then that they're going to know before it's in the paper what it says.
Right. Okay.
That's my constituency, really.
Yeah, thank you. So we got one last question, and this one's, I think, a very difficult one, and one, if any of you can figure out the answer to this, that we would all benefit from that. But short of requiring data literacy courses for politicians, how can we assure that data is used responsibly in policy? And I think, Governor Doyle, you mentioned the value side of this earlier, but any thoughts on this?
Well, we're politically in we've talked about it, as maybe you've made a good point, maybe it's not that unusual, but we're at a time politically, I'm just speaking, where we are very, very divided. And you all hear this, you know, the commentary that's made. We're very tribal, and how we see things depends on which side of a divide we're on. To go back to the Kavanaugh hearings, somebody asked me, did you believe her? And I said, I'm a Democrat, I believed her. I believed her not because I was a Democrat, but because I thought she was completely believable. If you had asked a Republican friend, and he or she would have said, well, I don't know if I believe her or not. She might be, well, the stuff they've all said. She might be mistaken. Maybe it was somebody else. And I don't think the people who say that aren't lying. I think it really demonstrates how we've made this point a couple of times about how you look at it. And so right now, data has in many ways a more important, because you've got to at least move forward with it. But climate change is, to me, the ultimate example of what do you do with data. And some people look at it and say, I don't believe that, or I don't care. And some people look at it and say the world's coming to an end. So I just think we're really in a hard time right now in which we are like two tribes, and we have our own cultures and our own ethics and our own perceptions, and that's how we funnel things through, including data.
Thank you.
So in other words, I have no answer to that question.
So whoever asked that probably won't like my answer, but I would say the harder you try, the worse it's going to be. I think you can't control people, and they're going to interpret things how they're going to interpret it. And the harder you try to control it, I mean, we've all been teenagers. You knew when, like, you were told to do something. Nobody likes being told what to do. Like, that's just, well, very few people, I should say, like being told what to do. And so you can't force somebody to see data the way you want them to see it. But I think, as a scientist, I should be responsible in how I'm generating data and that I'm not overhyping data or overselling data. And I think that's really important, and how, we work with the media is really important in that. And I think it goes back to building trust. Like, I might not be able to control how you interpret it, but I can have you trust me as a resource, and then maybe you'll come to me to clarify things. And so I think that's the only thing I can control, is my ability to try to build trust and not overhype my data, I guess. So.
Go ahead, I don't think I have
Well,
an
I mean,
answer.
from my perspective, the only thing I can do is when I see people monkeying with data, I call them on it. And I mean, that recent example is when the Department of Human Services kept changing their estimates of how much privatizing Medicaid was saving the state. I mean, they changed it just vastly. I called them on it and pressed them for explanations. And when they gave a circular explanation, I usually hate Q&A format. I think it's overdone, but in that case, the Medicaid director just gave this word salad explanation, and we did a verbatim Q&A and let people just read it. It was like this, and we just verbatim, here's exactly word for word what the man said, and you decide. And it was, that's all I can do with it.
Okay, thanks. Jen, anything you want to add?
Yeah, I think, for me, sticking with data, sticking with being factual, regardless of what trend we're in right now politically, I think we have to continue to do our best and continue to be thoughtful and listen to people, like Colleen said. And, I have far more positive experiences in my career of lobbying and working with people than I do negative. So I guess I still have a positive outlook that, this too shall pass, and things will, that we will have a better civil discourse in the near future.
Great. Well, please join me in thanking our panel this evening.